there. It's Marco and Cooper here. We're at the National Rural Health Conference in Blenheim, and today I have Ruth Stewart with me, who is the Associate Professor of Rural Medicine at James Cook University.
Yes, yes.
And today we're going to have a chat about rural medicine and academia.
Yeah.
So I guess to start off with, what was it that brought you into the world of rural academia?
I sometimes introduce myself as an accidental academic. So my husband and I are both rural GP obstetricians, and we'd been living and working in a little country town in southwest Victoria. At the stage that I became an academic, we'd been there for about 17 years. And a year after we arrived in Camperdown, another two doctors, actually my sister-in-law and her husband, started working in a town about 30 kilometres south of us. But from that time forward, no other doctors came to work in southwest Victoria, rural country towns. And so I figured they were doing something wrong. I was busy having babies and just working throughout the 90s. But I just thought, they must be doing something wrong in the universities. I hadn't particularly enjoyed my time at university. Well, no, I'd had a great time at university. I didn't particularly enjoy being a medical student, let's say.
I think there's a lot of us that can agree with that.
That's right. But I was really focused on becoming a rural doctor. I was a rural kid, grew up in a little country town, and I just, that's what I wanted to be. It took me a while. I'm a bit thick. It took me a while at Melbourne University to work out they didn't want to make me into the kind of doctor I wanted to be. So once I realised that, that's when I became a problem for them and probably a problem for myself. But so I did eventually manage, after a couple of missed calls, to get through my course, and found a life partner who was also interested in rural medicine, Anthony Brown. We married. And we went off to the UK, to Glasgow, to get our obstetrics training, and then came back to Australia to do our general practice training. And we settled in Camperdown to do that. Just loved the work, and all that, the time that I'd spent being a bit ground down, I suppose, by the big city institutional university processes. I got to Camperdown and found I can do this stuff. Not only can I do it, I think I can do it pretty well, and I love it. I love it. Just the variety of work, the engagement with the community, all those sorts of things. So it really worried me that I had the best job in the world and no one was following me. Like, what's going on there? So when Deakin University was successful in their tender to set up a rural medical school for southwest Victoria, I was really interested. And I looked at who was on the faculty and I thought, nobody in that list of people knows anything about rural medicine. And if this medical school is to train rural doctors, well, we need to have people like me on the faculty, so, I'll apply for a job. Now, I had, by this stage, already been on the board of the Australian College of Rural and Remote Medicine for about 6 years, and so I was well versed in the vocational training language and discourse. And I'd been a GP supervisor for, so this was 2008, for a good 10 years, as well as being trained myself. And I'd had an argument with one of our midwives and had begun a little research project that sort of got a little bit out of hand and became a PhD. So it started that. So I went in and applied. I applied for the job at Deakin, and I can talk, and I talked my way into that job. And my role was to set up the rural clinical school for Deakin University. So and it was a longitudinal integrated clerkship. So it was really just catching up with my mates, the other rural doctors in southwest Victoria, and negotiating how we could teach students in our towns. And I think the really significant things for New Zealanders to hear about this, given that there has today been an announcement by the Minister for Health, David Clark, that a rural training hub will be formed in New Zealand. What I want my rural colleagues in New Zealand to know is that if you are passionate about the health of your community and how to train doctors to work for those communities, it gives you an amazing level of authority within the university.
Yeah.
So I really found that actually, because I was an accidental academic, I could fight really hard for the things that I knew were important. You know, I'd look at the dean or, you know, my colleagues and think, well, if you sack me for this, I'll go back and I'll be earning a hell of a lot more money doing my rural clinical job than working for you guys. So, and it was stuff that I really cared about. So I probably fought pretty hard. No, I did. I fought very hard to establish the kind of program that there was strong evidence to show was successful in creating rural doctors. I became an academic because I really care about rural health, and it's still the case. Yeah.
And with all of the stuff that you've been involved in, have you seen a definitive increase in those being interested in rural healthcare?
Oh yeah. So let's go, for example, we'll go back to Victoria, where I was working when I became an academic. The Rural Doctors Association of Victoria conferences used to be really sad. We'd all stand around looking at each other thinking, oh gee, you look older than you did last year. You're probably working too hard. Oh God, that probably means that I look older too. Yeah, I do. Grey hair. And there just weren't any young people in that mix.
Yeah.
Our rural clinical schools have and a clear rural training program for rural medicine has, and probably, you know, some other things, but there has been a concerted effort to increase interest and the skills and competency to work in rural and remote medicine. And now the Rural Doctors Association of Victoria has, I think, only one of their board members is over 50.
Right.
And there's such a dynamic, excited, committed group of young rural doctors. And apparently the conferences now are a real hoot. So that's great. And look, when I moved 7 years ago now to North Queensland and have been working for James Cook University. James Cook University is a regional medical school. All of our teaching occurs in what other universities consider rural. But we say Townsville, Cairns, Mackay, they're not rural. So we have our rural clinical school, we use our rural clinical school funding to support training in the small, rural and remote communities across far North Queensland.
Yeah.
Actually across North Queensland, not just far North Queensland. We've got some pretty outstanding results from that program. Every single JCU medical graduate has had a minimum of 20 weeks in a small rural or remote community,
Yep.
and many of them have had a lot more than that. So the outcomes, and I wish I was better at keeping these figures in my head, but about 67% of JCU graduates are working in rural and remote, and a significant proportion of those are general practitioners, but we also have rural and remote specialists of all sorts of varieties. James Cook University now hosts one of the regional training hubs, which is focusing on vocational training.
Right.
We talk quite a bit about the pipeline so that you get local rural kids, bring them into the university, give them rural learning experiences early and often and long, and then you give them jobs in rural and regional towns for their PGY 1 and 2, and then you give them their training posts for vocational training. So are you going to be a GP? Are you going to be a surgeon? You give them those training opportunities in the country as well. So we haven't yet completed the whole pipeline, but we're just locking that last bit into place.
It sounds like you're definitely on the right track, and hopefully it's a...
And now I started to say, 7 years ago when I first went up to James Cook Uni, at that time the Queensland Rural Generalist Program was just beginning to have their graduates from that program. And my job with James Cook Uni was to double the number of rural placements, because we were doubling the number of students coming through. And I'd go to all of these towns and talk to the medical superintendents in the hospitals and the GPs, and they'd say, look, we are run off our feet, we're exhausted, we haven't got enough doctors, and you're asking me to teach. And luckily, because of the way the program is at James Cook Uni, I could say, okay, so you know the 6-year rural internships and how helpful they are? Yes, they'd all heard about them. And I said, okay, if you want one of those, you've got to give me a 4th year. So I would negotiate. But anyway, so they were exhausted. There weren't enough doctors everywhere. The next year I found actually some of the more popular teaching sites actually had some new graduates of the Rural Generalist Program, and that has just escalated. It's like the tide is coming in. And so places like Thursday Island, where I now live and work, for the first time in living memory, has a full contingent of doctors. We've changed lots of things about the Torres and Cape Hospital and Health Service models of care, and we now we've actually increased. So not only have we got a full contingent, but that's 30% more than it used to be. So it is really having an impact, and that it's not just Thursday Island, Mareeba, Mount Isa, Longreach, Emerald. It's all the little towns in between. They are coming back.
Cool.
So it's good to see.
Well, it sounds like there's some fantastic things happening.
Yeah.
Thank you very much for having a chat with us.